like, right? All right, so I'm curious about this. So I'm gonna roll through the femur. Here's the challenge. When people do this test, you're gonna end up doing this, and then a lot of times you'll just look at tibial rotation. Don't be skewed. So I'm actually gonna try and roll through that femur and use that as my guide, and that is stiff. Is that equivalent on both sides? Like, or give me the, Katie, what do you got?
It looks like we're a little bit more into internal.
More into internal? Okay. So then now I'm gonna grab greater toe cutter, and I'm just gonna see where that thing points laterally. Okay? So I'm gonna put it right there, and which is pretty neutral. Would you guys agree? With less than 19 degrees, you're like pretty standard, right? So now we're gonna and so how does this change anything? So the biggest thing is if I have somebody with some retroversion, and they're like, hey, I get pain with squatting, you've got to give them a little wiggle room and turn out, because that's their normal. And I think that's the only thing that changes. Most people want to be like, well, you should do everything, with leg external rotation. It's just whatever feels comfortable. And I think if they're going, this is the discussion I'll have with strength and conditioning coaches or CrossFit coaches. Like, if people are comfortable in that, don't try and change it, because we don't know how that sits in the socket. So let's go gross motion.